So yes, indeed, male infertility can stemming from genetic factors as well. We know today that there are certain genetic conditions, genetic variants of specific genes that can cause infertility, such as, for example, cystic fibrosis or Klinefelter syndrome. Klinefelter is where the males, instead of having the classic X and Y chromosome, they have an extra X chromosome. So these patients, they have the phenotype, as we say, as XXY. In which cases they can be quite tricky, and then the specialists they need to discuss options with those patients. And For example, there are the cases where we have, for example, cystic fibrosis. Cystic fibrosis can have, we have seen across the population, it can have approximately around 50 different variants. When we say variants, we mean different mutations on one of the CFTR genes, and it can cause different phenotypes on that patients. In which cases, cystic fibrosis, for example, is known to cause, in some cases, the bilateral absence of the vas difference in the males. In which cases these patients then need to explore the options with one of the specialists again to see what can be done. If they have to use donor sperm, if there's not a possibility to retrieve sperm from that patient, or if there is another medical intervention, so we can in the lab isolate sperm